Thank you, Maipal, and thank you, President Sir, for heeding to my, request that I'll talk first. So, President Saab is kind enough, and there's so many talks already on this. So, I'll repeat many of things. Flax is particularly useful in all the situations where regular emulsification is difficult, like heart cataracts, subluxated cataracts, zonal deficiency, and also in white intumescent cataracts where it is very easy to do a good rhexis. And why rhexis is done in a closed anterior chamber in case of increased interlenticular pressure, there are little chances of it extending outwards, and lens fragmentation causes tremendous softening of the nucleus, and nucleotomy becomes easy, and that is where it is very comfortable to do nucleus management even in posterior polar cataracts or with the posterior capsular defects. And here it is a heart cataract, as you will see. And I'll try to finish it quickly. So this is a cataract where this is a small pupil and I am putting a Malugan ring. You can put a Malugan ring beforehand, as Maipal showed in his talk, or you can use it at a later point in time if the pupil goes down while you are doing a flax, because quite a number of times the pupil goes down once you have done used a lot of energy in doing flax, and then you can use a Malugan ring in all these cases. And and then do the hydrodissection and rotate the nucleus. It was a fragmentation of the nucleus in small cubes. So once you have done a good rotation, there's hardly any possibility of leaving any cortical matter behind, because it comes out with this, it's with this kind of nucleotomies, it's like a hard cataract becoming at least 2 or 3 times softer, and I feel that grade 4 cataract, it becomes like a grade 2 or 3 cataract, and it is very easy to divide it, chop it, and then very easy to take it out even when this is a grade 4 plus cataract. So all these cases, you can comfortably do it without much difficulty. And once you have rotated, the epinuclear plate also comes out in one go, and there is very easy situation after the flex. So then you have to take the Malugan ring out. So you can take it out in one go by pulling it out straight, or you can take it in the injector and take it into the injector and go ahead and take it out like that. It's not difficult. This is another case of heart cataract, and as you can see, there is a floating capsulotomy here, and in all these cases, as you can appreciate, the nucleus is, it's become so soft, and also I am sure you can appreciate the RK cuts. So this video is showing 2 things, that the laser, femtosecond laser, is equally effective in cases where there are corneal opacities like RK cuts, and even in all those cases, it's not that the cuts will have any impedance in the cutting of the nucleus, And the only thing is that sometimes the cuts, these RK incisions, they open, and once they open, you have to suture them to get a complete closure. But it is important that these cuts will not hamper the efficacy and comfort of cataract nucleotomy. And this is the third case, which is again a very, very hard cataract. Here you can see, and it is again a grade 5 cataract. And here the nucleotomy, of course, is not floating, but it is very easy to disengage and take the capsulotomy out. And then you need to do a good hydrodissection so that nucleus is moving. I always want to move the nucleus and rotate it so that there is complete separation of the cortical matter from the capsule, and then there is hardly any difficulty in getting this out. And you can see that even this kind of cataract, it's not very difficult to chop. It becomes very easy to chop because the nucleotomy is already done with the femtosecond laser, and the nucleus is already divided into multiple small pieces, and this can be chopped also because they can be separated, and it can be taken out, emulsified in a manner like a grade 3 cataract in all these cases, as you can see. And it's easy in all these cases to manage the nucleus very, very comfortably. And okay, my time is over, so I'll just do it faster. Take the video here, show the injection of the lens, and that's all. Thank you very much.
Thank you very much, Dr. Bharti. India took 2 wickets in your talk. Thank you.